So today we are going to understand about head anatomy. So we can see this is the head and having multiple bones. So we can divide the head in two parts. Number one, neurocranium. Number two, viscerocranium. So neurocranium is this part, this entire part where we have our brain, right? So this is the part of the neurocranium. And the second is viscerocranium, especially this facial part, all the bones of the facial part. So this is called viscerocranium, right? So we can divide the skull into part, neurocranium, who is having brain, and the viscerocranium having the face. So now if we see the skull from the front side, we can see many bones. From the lateral view, we can see some different bones. So if we look at from the lateral view here, so first I would like to show you the bones we can see from the lateral view. So if we are looking the skull from the lateral side, the bones we can view, look at here. So we can view the frontal bone. We can know this is the frontal bone. Look at the another skull, this one, okay. So in this image we can see here, if we are looking from the lateral side, this side, we can see this is the frontal bone, okay. This entire is the frontal bone, this one. And then we can also see the sphenoid bone. Like if we are going down, so we can see this is the sphenoid bone. So sphenoid bone is connecting with the frontal bone and as well as connecting with this parietal bone and connecting with the temporal bone. So we can see this is the sphenoid bone. This sphenoid bone is very much important. We'll see later on. If we see the sphenoid bone, it's a very long bone. We can see this entire sphenoid bone. So this is the single bone, but it is from right to left, and it plays a very important role. So now if we are looking from the lateral view, so we can see here this is the sphenoid bone, right? Now in the other image we can see here, so we can see here this is the sphenoid bone, okay, fine. So now then the nasal bones. So we can see here the nasal bone around the notch. In this image we can see this, we can see there are two nasal bones here, right? One nasal bone the right side, one in the left side. So when we are looking from the lateral side, the nasal bone is visible. Then the lacrimal is located inside, who is very near to eye orbit. So we can see this is the lacrimal bone here. The tear formation is happening nearby. So we can see here, right? So if we remove the frontal bone like this, okay, if we see this part, okay, I am removing some part of the viscerocranium. So we can see this is the nasal bone, and here we can see the lacrimal bone, right? Okay. So we can see maxilla. So maxilla is this part. We can see this entire, this part is the maxilla, and these are the maxillary, upper teeth are the maxillary teeth who are connected with the maxilla. Here we can see this is the zygomatic bone. We are having the zygomatic bone is going on the back side, even going superiorly. So we can see this is the zygomatic bone. Okay, very important bone. Now you want to see in this other image. So zygomatic bone is in the lateral part, and the other zygomatic bone which we are holding, this is from the right side. So we have two. So now we can see the zygomatic bone is going up and uniting with the frontal bone, going down, connecting with this maxillary bone. On the back side, it is having connection with the, we see here, the back side, it's having connection with this temporal bone. So we can see here, this is the nasal bone. We can see from the anterior side. Then we can see this is the maxillary bone. Then we can go inside. So this is the eye orbit, lacrimal bone. We can see here. So nasal bone, maxillary bone, lacrimal bone, which we can see from the front side. Then this mandible, the jawbone, which we can see from the front side. Even this zygomatic bone, which is connecting the frontal, maxillary and temporal, we can see from the front side. Okay. Now, if we look at from the front side, just below this part, the junction of, we can see this glabella, this is the glabella or this notch. If we go on the back side of this, we will see very important bone that is called ethmoid. So let's remove the notch, remove this bone. Okay, now we can see this is the ethmoid bone. It's very important. So we can see this is the ethmoid bone, just hidden inside on the back side of the nasal bone, right? So here very small bone, one small bone is available, that is palatine. So now we will see the suture. So we can see this is the frontal part and this is the frontal bone, and we can see this is the parietal bone, the suture who is connecting frontal to the parietal bone. This is called coronal suture. Then we will see this is the occipital bone and this is the parietal bone. The suture who is connecting these two bones is occipital and the parietal, that is called lambdoid suture. We can see this is the temporal bone above the ear and this is the parietal bone. The suture who is connecting parietal bone with the temporal bone, this is called squamous suture or squamous suture. So there are two important points here. Number one, the junction of the center point, the junction of the frontal and the parietal bone is called bramma, and the junction of this parietal bone with the occipital bone, this junction is called lambda. So we are telling it lambdoid suture, and this center point is lambda. And this already we know, this is the pointed part, Inion, on the occipital bone. And there are some small suture. So we know this is the sphenoid bone here, sphenoid bone. So sphenoid bone is connected with the frontal bone, is also connected with the parietal bone, is also connected with the temporal bone. So we can see this junction. The junction from where sphenoid bone is having multiple connections. This junction is called pterion, where all the four bones meeting where all the four bones are meeting. It is called pterion. Now if we go on the back side, we can see this is the temporal bone, occipital bone on the back side, temporal bone, occipital bone, and this is the parietal bone. We can see in this skull. So we can see here this is the parietal bone, occipital bone, and the side temporal bone, the junction, where these three bones are uniting together. This is called asterion. So we can see here, asterion means three bones meeting on the back side, and terion means just we have seen this front side, the junction where sphenoid, frontal, parietal and temporal bone are meeting. Now here this small suture, there are multiple small sutures located here. So this is the sphenoid bone. Look at this side. So sphenoid bone, one suture making with this frontal bone, one suture making here with this parietal bone, one suture making with this temporal bone. So they are the three small sutures. So when the sphenoid bone are connecting with the frontal bone, it's making spheno-frontal suture. Spheno-frontal suture, we can see this. So when the sphenoid bone is meeting with the parietal bone, this is called spheno-parietal suture. Spheno-parietal suture. When the sphenoid bone meeting with the temporal bone, the suture is called squmosal suture, because this is the squamous bone, squamous suture. So this is called spheno-squmosal suture. So these three sutures are small suture. Now if we go on the back side, in the back side we know this is the occipital bone, right, and this is the parietal bone, and this is the temporal bone. So here there are formation of the few sutures. Now we can see this is a temporal bone. This is the whole of the ear. On the back side we can see some bony part of the temporal bone. This bony part, this is called Mastoid process. So this Mastoid process making suture with this upper bone, means parietal bone, and this Mastoid suture also making, this Mastoid process also making suture with this occipital bone. So one suture is here, one suture is here, these are two small sutures. So when this Mastoid process making the suture with this parietal bone, it is called Parieto Mastoid suture. Parieto Mastoid suture. And when this Mastoid process making the suture with this occipital bone, we can see here, this is called Occipito Mastoid suture. So these are two small sutures on the back side. So in this way we have seen the 5 small sutures. So now we'll be discussing the frontal bone in the next video.